School of Medicine in Atlanta, Georgia. I'm an ophthalmologist, and we just completed this report for the National Academy of Medicine entitled Making Eye Health a Population Health Imperative, a Vision for Tomorrow. And so this is available on the website of the National Academy of Sciences, Engineering, and Medicine.
You are part of the presentation this afternoon on some of the issues you just talked about, and you told the audience that you have some experience at the academies. Can you explain to me how useful the academy is to the ophthalmology community vis-a-vis advocacy and trying to move Congress to pass legislature that addresses the issues that you deal with as a community?
Yes. So here in the United States, it's a very complicated landscape for getting things done. And so the National Academies, which was actually pulled together over 100 years ago, actually, is intended to be an advisory group to Congress, essentially. And we take on projects that Congress has an interest in, but we do need funding from sponsors. And so I've been a member of the National Academy of Medicine since in the last 15 years. So this is the first time that they've taken on eye health as a topic. So this is an opportunity for us to really use this report to leverage our position that eye health matters, and it's important for us as a community to ensure that the importance of eye health across the entire lifespan really has the funding that it needs, not only for research but also for insurance. Yeah.
Some of the ways that we can promote and improve eye health is prevention and promotional methods. What would you say, especially to less developed communities who don't have the resources like you in America, on how to improve eye health using preventive methods?
Well, I think at every stage of life, there are opportunities to be preventive. At birth, to ensure that ophthalmia neonatorium is not an issue that's an infection of the eyes that children can develop if they're exposed to sexual transmitted diseases, and certainly having the necessary treatment at birth is critically important to avoid a lifetime of blindness, basically, and early diagnosis of diseases such as glaucoma. Critically important. I'm a glaucoma specialist, so it's important for family members and pediatricians to know the signs of congenital glaucoma, because it's a surgical disease, and it's something that can be surgically addressed early on, and if it's not, then that child can be blind. Having glasses available for children, certainly that would be an opportunity to ensure that when children go to school that they have the best vision to be able to see the front of the classroom or see their classmates or to read their books. And so getting people started on education, critically important. Having children screened for amblyopia or a lazy eye, certainly up until the age of 7, there's an opportunity for us to reverse the issues that, if not addressed up until the age of 7, if a child has a tendency towards developing a lazy eye, we can actually give them the opportunity to have depth perception if we are able to diagnose them sooner rather than later. So those are just a few examples of how childhood prevention can make a difference, and as you go through life, having the opportunity to screen patients that have diabetes for eye issues early so that we can intervene. We have treatments that are so much better than what they were 20 years ago that really do prevent blindness. If a person has a family history of glaucoma, ensuring that at the earliest stages of their adult development that they also have a comprehensive eye exam so they can have their nerves examined in the back of the eye. And then as people progress into their later adult years, diagnosing cataracts and getting people the opportunity to have their cataracts removed. It really is the gift of life, or the gift of sight, but it's also the gift of life because depression is a significant factor for those individuals that have visual impairment plus eye diseases. I mean visual impairment and chronic diseases such as diabetes and hypertension and stroke.
In your experience, you must have dealt with diverse communities and groups of people, and you also referenced the zip code as a major contributor to some of these issues we are dealing with, and not primarily the genetic code. What are some of the social determinants which are making the African American community to be having a predominantly higher percentage of ophthalmology and eye problems than maybe the Caucasian and Asian and other communities within the American environment?
So certainly one of the challenges is just having access to eye care and having the insurance to pay for it. You know, the insurance is an issue. Oftentimes, vision care, eye care is carved out. So, you know, getting access to patients or to providers can be a challenge. And also, just and I'll just backtrack to, you know, the general knowledge of how does one protect your eyes. I mean, sports injuries, that's a big issue in the second and third decades of life in particular, as well as the first decade. We have kids that don't wear the necessary eye protection when they are engaged in contact sports. And so, you know, having the opportunity to actually ensure that they, you know, have some eye protection is critically important. So I would say that it's eye health literacy as well as insurance. Those are two big issues that as a community of color we need to actually address.
How do we increase the number of women who are consultant in ophthalmology? You are an example, a successful one for that matter, a vice dean of a medical school. I know there have been lots of odds in your way to get to the stage where you are, and that's a very commendable attainment for you. But how do you also get other young ladies to get to ophthalmology and be maybe able to come to your level? What advice would you give?
Follow your passion and follow your dream, and be persistent in doing that, and regardless of what barriers come your way, is to learn from those barriers and just remain resilient, because, you know, certainly life is not easy when you're in certain environments where you're not able to have a voice, and somehow you need to find that voice. Seeking out colleagues who can help bolster you in those moments of weakness and uncertainty, and rely on your family and friends for, you know, that emotional fortitude, if you will, to just keep on going.
The last question. Let's talk a little bit of policy. And in policy formulation, we have agenda setting, policy formulation itself, the implementation, the evaluation. Then the last phase most times, which is looking at the policy and trying to find out if the goals intended worked, what is supposed to be done, maybe to make changes or to terminate the policy. At this stage, I think that what the American Health Care Act is coming to do is to make changes in the ACA. There are many people who think that it's terminating the Affordable Care Act, but if we follow policy and how those things are done, they need 60 Senate votes for that to pass. That's not going to be possible. With your experience, what would you say to people who are confused out there about, and they are fearful, especially in the African American community, about the coming of the American Health Care Act? What do you have to tell them, as a voice, as a leader in healthcare about these issues which they are grappling with?
I mean, one simple word, vote. I mean, basically vote for politicians who are going to support the path back to the Affordable Care Act, because what was done by President Obama was to show us what's possible. We had an additional 22 to 24 million people who were actually insured. It's likely with the changes that are underway that those individuals will lose their insurance. And I am concerned that it's just going to make disparities in health even greater. So I think we need to galvanize our community, just like, when I was growing up in the Civil Rights Act, and we galvanize around certain candidates who are going to support civil rights. I think we need to return to those activist days. I think we need to call our Congress people, but now is the time to elevate your voice because the tide is being turned back, and it is going to hurt our community. So I think there is cause for concern.